Welcome everyone to the Ask the Expert webinar. I am Jan Chambers, President and Founder of the National Fibromyalgia and Chronic Pain Association. I am delighted to have as my guest today, Dr. Ginevra Liptan. She is a graduate of Tufts University School of Medicine, board certified in internal medicine, and trained in functional medicine, a holistic approach that blends Western medicine and alternative medicine. After developing fibromyalgia as a medical student, Dr. Lipton spent many years using herself as a guinea pig to find successful treatments and has fine-tuned her approach by treating thousands of patients at the Frida Center. She is one of the few clinical specialists in the world to focus solely on fibromyalgia and directs the Frida Center for Fibromyalgia in Portland, Oregon. She also serves as medical advisor to the Fibromyalgia Information Foundation and is on the board for the nonprofit Mastering Pain Institute. She is the author of the FibroManual, a complete fibromyalgia treatment guide to you and your doctor, and earlier, Figuring Out Fibromyalgia, Current Science and the Most Effective Treatments. So your newest book, the FibroManual, Dr. Lipton, I was so delighted and excited when I read it. And there are two parts to it. So before I launch into the interview, though, welcome. We're so appreciative that you are here with us today.
Thank you for asking me. It's my pleasure.
In the two parts of your book, one is for patients and the other is for doctors. And I asked in a couple of questions with you prior to this interview, if you'd please consider helping us as patients to understand how we can work with our doctors to bring this book to them so that they're receptive to hearing more information about how to treat fibromyalgia and for us to understand what we should be looking for in fibromyalgia treatments.
Absolutely. So I wrote this book because I felt like there was a huge gap between what researchers and those studying fibromyalgia knew compared to what your average primary care doctor who's trying to help a patient sitting in their office with fibromyalgia. And so I thought if there was some way I could sort of condense the information in a way that made sense and was easily applicable to a primary care doctor's interaction with a patient on a one-to-one basis, that would probably be the most beneficial thing for both the doctor who might want to help their patient with fibromyalgia but not know how to, and then the patient who desperately needs their doctor to help them, but the doctor doesn't have that expertise. So the patient is sort of left to, and I've had this experience myself, trying to figure it out myself and then bring information to the doctor and say, hey, what about this? Could I maybe try this? I'm sure we've all had that experience. So I was trying to sort of develop something that could be sort of like a translation between what doctors know, doctors that treat fibromyalgia and specialize in it, but maybe your average primary care doctor might know. So the book is divided into sort of things we can do for ourselves and things that we might need healthcare providers help with. So the end of the book, there's an appendix about 12 pages that you can photocopy and bring in to your doctor. And my suggestion for folks, as far as trying to start that discussion with their doctor, is to say, you know, I know fibromyalgia is kind of a complicated condition. Would you be willing to work with me over several appointments so we could really dive into all the different issues I'm having and try and develop a plan together? So kind of trying to be cooperative with them, but understanding the time constraints that doctors are under, particularly primary care doctors who get maybe 5 to 10 minutes per patient, be about 20 patients a day. I thought if people could really work frequently with their doctors, see them monthly for a period of time, and kind of together develop a plan, that would be the most helpful way. And understanding that doctors really need communication to be primarily in the exam room, not over email or phone, and kind of trying to respect, showing the doctor that you respect their time constraints. I think that can make a huge difference in how you're able to kind of communicate and get your doctor kind of to be on your team.
Oh, those are really great suggestions. I appreciate that. But as I envisioned me taking this book to my doctor, I thought the easiest way is for me to give it to him as a gift and say, I've brought a gift. And then the approaches that you just mentioned of talking to your primary care or your internist or your rheumatologist, whoever is helping you with that primary care, to open up that door, that dialogue. And I also felt that I needed to be more familiar with your book and the material in your book, so that if the doctor said to me, well, where would you like us to start the discussion, I would be familiar enough with the material that I would know where I wanted to start. Because your book is divided, it's up into sections, but it is so well-rounded in its approach. And I appreciated that. You took a lot of thought as a person with fibromyalgia when you wrote this.
I did, because I'd been so overwhelmed when I'd read other books about fibromyalgia. It felt like there were so many suggestions and supplements and things. I just felt like I didn't even know where to start. So I really wanted it to be something that kind of was sequential and made sense. Because, when your brain is foggy and you're trying to figure out what's the next step, it has to be really streamlined and kind of methodical. So I was trying to really winnow down to those most important things. And I do agree with you that if you come into your doctor's office and you're really well prepared, knowing what your symptoms have been, kind of been tracking your symptoms, maybe tracking how you've responded to medications or treatments, that you're going to be able to kind of get further in that appointment than you would if you come in and sort of don't quite know where you want to go or what you've been doing. I mean, doctors love data. If you can bring in any information about how you might have responded to a medicine or a treatment, what your pain levels have been, that information is so valuable, because then you can really together look at that data and say, oh my gosh, when I made that change, look, my pain scores went down. That right there can help both of you to understand better what's working and what's not. And we tend to forget that because it's so hard when you're feeling foggy or in pain or exhausted. The last thing you can remember to do is write down your symptoms. But if you get in that habit, even just doing it on your smartphone, on the Notes app, on a calendar, there's even some good pain tracking apps out there. Bringing that data in, so valuable for both of you.
Oh, thank you. I appreciate that reminder to get in the habit of just noting how you feel that day, and if there's something extra special going on that day to affect your energy or your pain or any of your symptoms, to just note that. So the pain tracking, the symptom tracking is huge, and I know you recommend that wholeheartedly. You are speaking in dual tones here. You're speaking as both an experienced person with fibromyalgia with your own journey and as a primary care doctor who helps people. Would you please share with us a little bit of your journey?
Sure.
Thank you.
When I was in medical school, towards the end of my first year of medical school, I was exercising in the gym and I was lifting weights, and I felt muscle in the front of my neck rip. I'd never felt anything like that, but I assumed, just like any other injury I'd had in my life, that it would heal up. But it didn't, and the pain from my neck kept getting worse and worse and more severe and spreading. So it was in my upper back and then my lower back. And over that summer, between my first and second year of medical school, I developed profound fatigue. I had a part-time babysitting job, and if I did a few hours of work, I was exhausted and in bed for 3 or 4 days. And this kind of went on for several months before I realized, something's really wrong here. And then I went to see my primary care doctor, who said, you're fine. Maybe you're a little stressed out or depressed, try an antidepressant. And I knew that wasn't what was happening. I knew there was something else going on. So that kind of started my own journey to figure out what's happening with me and what to do about it. And it went on. I saw multiple specialists in Boston, some of the top specialists in the country at the time. No one could tell me what was going on. And I realized that I was going to have to figure it out for myself, which unfortunately so many of us have been in that place. And ultimately, I was diagnosed with fibromyalgia by my chiropractor. And that was both the best day of my life and the worst day of my life, because getting a name to it was a huge relief. But realizing that it was chronic, and realizing that there wasn't great treatments, and realizing that at that time, most doctors didn't even believe it was real. That was devastating. And I think we've all experienced that crushing realization, compounded by the fact that I was in medical school. I was supposed to, medicine was supposed to be the answer to things. So I really lost faith in medicine because I didn't feel like my doctors have been able to help me. I eventually, through finding some alternative treatments and changing how I was eating and exercising, I was able to kind of stumble back towards medical school after a year off. But I didn't know if I was going to be able to continue or if I needed to go on disability. I didn't know. But what really drove me back was the feeling that if I can't figure out fibromyalgia, nobody can, because I've got this medical training and here I am as a patient. And so I felt like it really was up to me. Like I owed it to everybody with fibromyalgia to try and get back to school, finish my training, and devote my career to figuring out what the heck is going on in the body, and then how do we treat it. So people ask me a lot, like, how did you get through medical school and training? And I have no idea. I would say I stumbled through.
We're so glad that you did, because you're a strong voice, a very strong voice, and we need you. We appreciate you very much.
Thank you.
You mentioned, yes, and we do find ways to move forward when we start paying attention to our symptoms, and then finding those our own bag of tools that we use repeatedly. And that you mentioned something during your journey, and thank you for sharing that personal information. You mentioned something about alternative treatments. You did a beautiful job in your book of combining the holistic approach with the medications and with self-help treatments, as well as the alternative therapies. So some of those alternative therapies are a little new to people, and I don't think that many of the primary care providers are familiar with things such as myofascial release or dry needling. I was wondering if you could please touch on those alternative therapies.
Absolutely. Part of why I included that in my book is because I feel like alternative medicine alone is not enough to manage fibromyalgia, nor is just pure Western medicine. I think if you take the best of both of those, what really works from both those worlds, and combine them, then you've got the most effective treatment regimen for fibromyalgia. So what helped me the most, and what kind of has interested me, and I studied it through my career, is this alternative treatment called myofascial release, which is basically a form of massage, but it's not what we think of as massage with kind of like kneading or rubbing. For a lot of us, at least for me, massage itself can sometimes flare me up. This is more like gentle, prolonged stretching of the connective tissue that is around our muscles. And in fibromyalgia, the theory is that the connective tissue around our muscles becomes very tight and inflamed and painful and knotted up. So you can get these trigger points, which are very, very painful. So dry needling does help with that. So that can break up those knots. And then myofascial release is just kind of gentle, prolonged stretching that breaks up that connective tissue. Very helpful. And it's not painful the way that massage can be for folks. And there's been 2 large studies in Europe looking at myofascial release that have found it to be helpful for both pain and actually fatigue reduction as well for fibromyalgia.
Thank you. When I first encountered the term fascia and myofascial release, I could not visualize how that looked in my body. And so I often use the analogy of the chicken skin. Can you describe it a little bit, please? So that we can. Yeah.
Absolutely. Yeah, it's hard to kind of visualize. And if you're a vegetarian, I apologize, you might not get the reference, but if you have looked at a chicken breast when it's raw and you see that sort of translucent coating, so underneath the skin, there's sort of on top of the muscle layer, there's a translucent coating that you can peel off. That is the fascia. And all muscles, whether it's in the human body or the chicken body, have that coating of connective tissue. And it's really sensitive to pain. It's actually where most of our pain nerve endings reside, in the muscles. It's about as sensitive to pain as our skin. So if you imagine, it's sort of like our second inner skin. And that is exquisitely painful in fibromyalgia and really tense. So I kind of use the analogy sometimes of like a really dense block of taffy. So if you imagine it's sort of really solid, instead of being nice and, after you've pulled it for a while, nice and soft and squishy, myofascial release can help get your fascia from that dense taffy to more soft and pliable, and that usually means less pain.
Oh, that just feels relaxing to even think about. Thank you. I appreciate that. Sometimes it's counterintuitive. When I'm in pain and I am feeling so overwhelmed, I just want to freeze and hold my breath and not breathe. And some of the things that we need to do are so counterintuitive, like stretching. It doesn't seem normal to me that when something's in so much pain that I should get up and stretch it. But my experience, I know now that that's exactly what I should do. What other kinds of counterintuitive actions should we take?
I think you raise a very good point, and this is why it can be so hard to figure out what to do, particularly when you're in the middle of a flare and all you can really think to do is to just kind of hunker down. And that is our natural instinct. I do the same thing. We just kind of want to stop until it passes. We're going to hold our breath and stop until it passes. But actually, what's much better for us is the counterintuitive approach to move gently, to stretch, to breathe deeply. And in fact, the whole concept of exercise in fibromyalgia is fairly counterintuitive, because when you are exhausted and feel awful and achy, the last thing you want to do is exercise. But yet, every doctor that you see, and lots of studies, over 80 research studies now, show us that exactly what we should be doing is exercising. So what I've found to be helpful is to take the word exercise and throw it out of my vocabulary completely, and instead replace it with gentle, therapeutic movement. Because it doesn't necessarily need to be exercise like we think about. We think of exercise and think about jogging or walking. What I'm talking about is literally maybe gentle range of motion, or stretching, or even just kind of getting up and changing our position, and then allowing our body to really breathe differently and breathe more deeply. Because when we're in pain, we tend to breathe very shallowly. And so kind of that counterintuitive doing what's not coming naturally. But the more you do that and the more you see the benefits from it, then it can start to come naturally. That's kind of where the concept of practice comes in. And I found that over time, really one of my more stressful times is when I'm sitting in traffic and I'll notice that my pelvic muscles or my abdomen is really clenched, or my jaw is really clenched. And as soon as I feel that, now with time, practice, as soon as I feel that tension, I tell myself to drop my shoulders and I try and breathe into my pelvis, and it makes a difference. Of course, I have to do it 15 times a day because my body naturally wants to go back to that. But with practice now, I can more quickly get into that. And it's almost habitual, where I can kind of trigger myself to do that. So we have to kind of train ourselves to do those counterintuitive things. This is where having support, having fibromyalgia buddies, people that are going through the same thing, people that can share their tricks with you, people that can say, oh, hey, yeah, when that happens, I do this. That can be so hugely valuable. In fact, at my clinic, I actually have a class where people get together with me, about 5 or 6 of us usually, before we even start with appointments or anything, so that people can get to know each other, and then be a support for each other. And that piece of it, that peer support, is, I think, almost as important as what we do in the exam room, one-on-one. Maybe even more important, you know, because people can share their own tricks and what helps them to do the counterintuitive things that ultimately are helpful for them.
Well, thank you for covering support groups and the value of them. I've led support groups for years and benefited so much from not, you know, I'm even as the facilitator to participate in the conversations and suggestions and just being accepted for, I need to get up and move right now.
Yeah, exactly. Like, it's okay if you could lay down, or I mean, and I think that's why the work that the National Fibromyalgia and Chronic Pain Association that you and your group is doing is so important, because you provide a voice for all of us and provide kind of a safe place of acceptance and also advocacy, because we need to be able to kind of stand together and work together. So I wanted to take this opportunity to thank you for all the wonderful work that you have done.
Thank you. I wasn't anticipating that. It's a labor of love, and we are so grateful to be able to be working in this space. There's so much need, as you understand, and the suffering that's being increased now with the additional stigmatization is alarming. So we work very hard on advocacy and education. Sorry, I'm a little choked up.
I'm sorry.
Thank you.
Let's do that one. Sorry.
That's great. Thank you. I really appreciate that. As I worked with your book and I was thinking about people with flares, and I thought, oh, you know, there are times when I've been traveling a lot and I get a little foggy and I think, I'm not quite sure, I can't remember quite what, you know, I'm supposed to do right now to help myself. And so I actually have my own list at home, but when I'm traveling, it's a problem. So I have your book on my computer so that I can use it to help myself out of a flare. And I think that other people have the same experience when they get into a flare. You can't think the logical steps through, and so preparing for that is important. And I know that your book you developed it with, you know, with part of that in mind.
Absolutely. And I think, I mean, I wish that there was one flare plan that worked for everybody, but we're also different and individual. There's some things that work for a lot of folks, but we all need to kind of figure out what works for us and then write it down somewhere so that when we are foggy and in a flare and when you can't think, which is absolutely true, that you can reach for that and say, okay, all right, yep, okay, I remember I need to do an Epsom salt bath. Okay, I'm going to do that. And some things are harder to do when you're traveling compared to at home. You might need to have like a traveling flare kit plan and a home one. And maybe even share it with someone you live with or love. So if you're feeling kind of lost and confused, they can help remind you what to try. For me, over the years, I've found that if I can catch things early enough, if I can recognize that I'm heading towards a flare, sometimes I can head it off at the pass. So kind of trying to recognize what are my signals I may be going into a flare. And for me, it's usually feeling a little bit foggier than usual, a little bit more painful in my usual areas of pain or maybe new areas of pain. I know if I don't sleep well for a few nights, I'm probably going to go into a flare. So when I feel like maybe that's coming on, what I like to do is use some topical anti-inflammatory gels, whether it's prescription or non-prescription, on the area that hurts to see if I can calm that down. And then I often will also take a muscle relaxant and then try and take like a warm Epsom salt bath and see if I can really relax my muscles and try to head it off at the pass. Now, sometimes life is stressful and it happens and you're gonna be in a flare, and then trying to just shorten it and grab for those tools as much as you can that you know are gonna be helpful. And this is actually where support groups, I think, can be really valuable to kind of work together to learn, you know, seeing what someone else does for their flare plan can actually give you ideas for yourself. And like, oh, I never thought of that. That's a great idea. And I mean, I learn from my patients all the time. Like I have this wonderful experience of, it's not just me, my experience that I can tap. It's thousands of patients that I've talked to, and I've learned tricks and tools from them. Absolutely. And that's part of what I tried to combine and condense and share in my book. You know, it's not, I don't have all the answers, just trying to kind of find what works for most folks, and to try and find those things that maybe your doctor might not know about, but they really should. That's what I was trying to convey in the book.
And you did very well. As I read that, and I watched the section for the doctors and helping them to understand why different prescription medications work, how they work, and in maybe in combination for different symptoms, I felt like that was something that patients could feel really comfortable and confident with, not only for their own understanding of why their doctors have prescribed something, but to know that their doctor has some tools, that it isn't just based on their experience. It's kind of a support for them also.
Yeah, that was exactly what I was trying to do, because I will say so many doctors tell me, you know, I believe fibromyalgia exists. I know that it's real, but I don't know what to do about it. And I know that things have been changing over the past few years, because I have been invited several times to local primary care clinics, big clinics, to talk to their primary care doctors about how to treat fibromyalgia. And that's so different. I mean, 10 years ago, if I went to them and said, hey, I really want to come talk to your doctors about fibromyalgia, they would say, no, thank you. Like, that's not. Now they're inviting me to come. They want to know. They just don't know where to find the information. So I feel like now more than ever, your doctor might be open to really learning some new things about fibromyalgia. So
I agree with you. And I think that the changing prescribing patterns due to the concerns about opioid medications and the heroin use, it is changing how people with chronic pain are being treated in the offices. That's both positive and negative. Yeah. And so, but thank you. As you were speaking, my mind went back to what you said a little bit earlier about the Epsom salt baths and the magnesium. And one thing that I just don't travel without, I keep it all the time in my purse, is a calcium magnesium tablet. And I have found that when I start feeling muscle cramps or something, why does the magnesium work? I found that by accident.
So magnesium is the relaxation mineral. It is a relaxing mineral for our nervous system and for our muscles. So it's kind of a natural muscle relaxant and a natural nerve calming agent. And you can imagine, with what we're dealing with fibromyalgia, that would be the perfect combo for what we need. So the other component is that in fibromyalgia, our nervous system is kind of stuck in that fight or flight stress response. And that fight or flight response really burns through your body's normal magnesium. So we tend to be very magnesium deficient. And when they do studies looking at, magnesium levels in fibromyalgia, not blood magnesium, but if you look at like hair component analysis, we tend to be very low in magnesium. So if you can add back that magnesium, it can really help to kind of calm the nervous system down. And you can do it with orally, like you do. That totally works. And then I was delighted to find a few years ago that they actually make magnesium lotions and creams and oils that you can rub on topically. And we absorb magnesium pretty well through our skin, actually. And then finally, the Epsom salt bath, which is one of my favorite things in the planet, which is basically magnesium salts, and you can bathe in it. And if you're really lucky and live in a town that has flotation therapy, which is these kind of bathtub pod things that are filled with really densely dissolved magnesium water, you actually float in it. Oh. If you're in that for an hour, you absorb like a month's worth of magnesium, and you walk out of there feeling beyond relaxed. I don't even know how to describe it. It is a very unusual feeling, but for some people with fibromyalgia, it can be so heavenly. I have one patient who feels like floating once a month in a magnesium flotation device has helped her more than any medicine has.
So that's almost a call to, if you have the opportunity to go to another city, I would look for a flotation with the magnesium. I'd like to try that.
It's definitely suiting. Like in Portland, where I live, there's about 5 different flotation clinics.
Wow.
So, yeah.
I don't have those here, so I would love to come to those.
You have to come visit.
I will someday. We might have an event there next year in 2017.
Right.
The one other thing that I didn't have on the list, and I just know that of questions, is that sometimes iron is an issue. What should people be watching for or ask their doctors to notice on that?
So particularly if you have symptoms of restless legs, where your legs are really uncomfortable and you feel like you need to move them a lot at night or when you're kind of sitting at rest, that can be a sign of iron deficiency. So what I will tell people is kind of in the normal panel of labs that your doctor should be getting for fibromyalgia. One of them is to check your ferritin level, which is a marker of kind of how much iron you have in your body. And even if you're kind of technically within normal limits, but if your ferritin is under 50 is kind of the goal, you really want to take some iron supplementation to get up to about 50, because your body and brain use iron to make really important chemicals like dopamine. And dopamine is sort of our pain, our natural pain suppressant chemical. So sometimes people will have a low level of iron deficiency, not enough that they're anemic, not enough that it shows up as wildly abnormal on their tests, but just enough that their brain can't quite make enough dopamine. And without enough dopamine, you're really going to struggle to have the natural pain suppressant capabilities. So that's one of those subtle things, and I do believe I wrote about it in the FibroManual, because that little difference, maybe just adding iron supplement or kind of increasing the red meat or iron-containing foods that you eat, can make a huge difference. But people don't know about that, you know. And of course, it's important to talk with your doctor and make sure that you are safe to take an iron supplement. But that's something that if you're low-grade iron deficient and you correct that, that can make a huge difference in how you feel.
Oh, yes. Thank you so much. You know, everything you're saying, you're encouraging us to understand our own bodies and to get familiar with them. And that's such a big switch in perspective, because so often we're upset that we are limited from things that we may want to do. And so after, 10 years now being diagnosed with fibromyalgia, I know how important it's been to come to a place where it's just, this is my life and I want to have as quality of life as I can. So I work to maintain or to watch, as you're saying, when you start to feel the fibro flares come on. So I appreciate what you're saying as far as feel comfortable to explore these different tests, look through your book, read through your book, use it often. It is full of wonderful, important, life-changing facts and personal experience.
Thank you for saying that. The book that I wish I had when I was diagnosed. That's what I was trying to write. So I sincerely hope that it helps.
It is, and when people are newly diagnosed, it's often a very hard path to start because everything looks the same on the internet. It's hard to determine what is good science and what is a good recommendation. And so as the president of the National Fibromyalgia and Chronic Pain Association, I encourage people to have a copy of this book. I encourage people to feel comfortable giving it as a gift to their primary care provider and to use it often. There's a lot in there that is pretty scientific or deep, but as you get familiar with your body and how it relates to the different symptoms that you talk about, it's very user-friendly. So you kind of can grow into the book too. You can pick it up and use it immediately, as well as once you've worked through those things, and there's more material to consider. I have really enjoyed and appreciated talking with you today. Is there anything that you'd like to say about, or that I haven't thought to ask, or we haven't covered?
I don't think so. I would just say I encourage everybody who's dealing with fibromyalgia to look at themselves like the warrior that they are, because it's really hard when people can't see what you're dealing with. But remembering that there are people out there that understand kind of the invisible burden that you carry, and remembering that you're not alone. So that's what I would say. And I would say, Jan, thank you again for all the hard work you and your group do. And thank you so much for interviewing me. I appreciate this opportunity. This is Dr. Lipton. I wanted to thank you all for joining us today. And I also wanted to say thank you for sending in such great questions. I was really impressed by both the quality and the quantity, the volume of questions that we got. I'm only going to be able to answer a small percentage of those today in this brief question and answer period. And then I am also going to try and answer a few of the live chat questions people submitted. But there were so many good questions that I have been looking forward to this opportunity. I really want to make sure everyone gets their question answered. So I'm going to do, over the next several months or so, do a column or an article with the NFMCPA where I answer them. So stay tuned for that. And Jan and the NFMCPA folks will share details about that for you. First, I wanted to answer a question that came up on the live chat saying, what do I think about trigger point injections? And what I think is they are fantastic. I like trigger point injections a lot for those tender knots that show up in fibromyalgia muscles so much. It can be done both with medication or without. So without medication, they call it dry needling, where basically they're, it's a physical therapist or doc that's finding that tender spot, that knot, and putting the needle in there to try and break up the tissue. I don't love that as much because it's pretty painful and you don't have that numbing medicine. I prefer the trigger point injection that includes numbing medicine, because we all need a little numbing of the nerves. So then when you get that numbing medicine in there, then the needle can really do its work without us kind of tightening against it. Sometimes they do include steroids as well. I'm not as big of a fan of the steroids just because they can have some side effects, but for certain really big, very painful trigger points, particularly in the lower body, the steroids, if you add that in along with the numbing medicine, can be helpful. So I think it's totally worth, if you've got a real specific knot, talk with your provider about seeing whether you could get a trigger point injection. The other live question I wanted to answer was about whether acupuncture could be helpful. And I will say acupuncture, it's kind of split 50-50. About half of my patients report acupuncture helps, reduces their pain. Others say they either don't get benefit or kind of feels like it might flare them up. So I think it's worth a try. I particularly think it can be helpful if you have a joint that's inflamed. So let's say you've injured your shoulder and that whole joint is really inflamed. I think acupuncture can be very helpful to reduce the localized inflammation and pain that you might get from an injury or an overuse strain. So those are the two live questions that we've got time for. The ones that were submitted previously, I think, Jan, can you put that up? So the first one is, can a person prove they have fibromyalgia? We are getting close to that. We are getting very close to there being some actual objective lab tests that can demonstrate for sure that somebody has fibromyalgia, which would make things like applying for disability, trying to get insurance benefits to pay for things. I think that it could really revolutionize how fibromyalgia is dealt with. But it's not quite ready for prime time yet, excuse me. So there's two tests that I think have the potential to really be game changers. The first is called FMA. It's FM/a. And that is a test that looks for patterns of inflammatory chemicals that you see in the blood of people with fibromyalgia that you don't see in people that don't have fibromyalgia. So that's the key to getting a good diagnostic test. It's still in early days yet. It's not been widely studied, but I think that it has the potential to really become that diagnostic marker for fibromyalgia. The other option, and you asked about genetic markers, there are some tests that show a genetic predisposition, meaning you're more likely or prone to develop fibromyalgia. But there's none that can say definitively based on your genes that you have fibromyalgia or not. So I think there could be down the road a combination of sort of genetic markers plus maybe this inflammatory chemical panel that could really give us kind of some definitive blood work. There is some research being done on this. It's actually, a lot of it is being done by private companies that are developing these tests. So until it really becomes more mainstream and starts getting studied by the universities and by the NIH, I don't think it'll be as widely accepted, but these companies are really bringing things to the forefront, and it's pretty exciting times for scientists like me in fibromyalgia research. So stay tuned. I think we're getting close there. Can you move to the next slide? There we go. Thank you. So this kind of goes back to that if we had a diagnostic marker, we could say, yeah, okay, I know I have fibromyalgia. You could show the doctor the lab test. Life would be much easier. We don't have that right now. So the best way that I have found to kind of try to show a doctor that might not understand or be able to see your illness is to do two things. Show them the research data that is out there in a language that they understand. So not things printed off the internet or chat rooms, which might be more in patient language. You want to make sure you're giving them things in doctor language. So that's part of why I wrote the appendix in the FibroManual, is because I wanted to summarize in doctor language, what's the science? What do we know that's going on in fibromyalgia? And that will help them to at least understand the process that's going on. Now, how do they understand what's going on for you and how it's affecting your life? That part comes to your ability to demonstrate to them. And there's two things that help. One, getting into the office frequently so that they can see you when you're in a flare. They can see how fibrofog might be affecting your ability to answer their questions. And also to record your symptoms in some sort of regular way, maybe 0 to 10 scale ranking of pain, fatigue, and fog. record your symptoms for a month, and bring them that data. Doctors love data, and it helps them to work with you and helps them to understand, oh my gosh, your pain was a 10 out of 10 this whole week. What was going on that week? Helps them to work it through with you, and also helps, sort of like a diabetic bringing in their blood sugar logs. It gives the doctor something tangible to work with you on. As a doctor, I can tell you that is really, really important. So keep track of your symptoms and bring them in some actual data about the science of fibromyalgia. Next one, thank you. So I'm sure we've all discovered that there's not really a doctor that's particularly perfectly suited to treat fibromyalgia right now. Primary care doctors don't have that much time to either talk with you or research things. And then rheumatologists, pain specialists, sleep doctors, neurologists, endocrinology, which is hormone doctors, all of those specialists address one piece of the fibromyalgia picture, but there's not really anyone right now that does all of those. So that's why I labeled myself as a new specialty. I'm creating a fibromyalgia specialty because I think the perfect provider needs to have some experience in pain. They need to know about rheumatology. They need to know about sleep. They need to know about hormones. And until then, the best type of doctor to treat fibromyalgia is whoever you have available that's willing to work with you. So that can be a primary care, that can be a rheumatologist, that can be a pain specialist, that can be a neurologist. Basically, if someone is willing to listen to you and willing to say, okay, let's sit down and see what we can do about this. I might not understand it, but I'm willing to try and work this through with you. That's the doctor that you want to work with. And then bring them in a book like the FibroManual and say, okay, here's the appendix at the end that's for you. Will you work with me on these steps? That's the right person. And I'm diligently trying very hard. Part of my career goal is to try and educate other doctors so that there's more of us around that know how to deal with fibromyalgia, because we all know that there is a shortage of those type of doctors. So in the meantime, we do the best we can with the doctor that is available and that is kind and willing to work with us. Next slide. So this kind of goes back to the earlier one about kind of the documenting, so keeping track of your symptoms. If you wanted to go really in detail about this, if you go to rheumatology.org, they have, there's a symptom tracker that is the same that we use for fibromyalgia research studies. That's called the Fibromyalgia Impact Questionnaire, and it's available on rheumatology.org, and just search for FIQ-R, so it's FIQ-R, and that is actually what they use in the studies to document the severity of fibromyalgia. So to see if treatment improves fibromyalgia symptoms. So I encourage you, particularly if you have a doctor that really likes details, to go there and try and fill that out and bring it into them. So this next one, we talked a little bit about this in the interview, but the fascia, connective tissue around the muscles in fibromyalgia, is very tight in response to that chronic fight or flight response. And I know exactly what you mean, feeling like you've pulled muscles even when you haven't done anything strenuous. And then they can get really tight, and then you get those knots, which is the trigger points. And then everything, like sometimes it can just feel like your shoulders are up near your ears, and everything is really, really tight. So we'll talk a little bit, one of the next questions is about treatment for that. So let's move to the next slide. First, we'll go a little bit into this challenging question, which is, how do we explain to fibromyalgia to a family member or someone that doesn't understand? So the challenges here is that we might look okay, right? We all, invisible illness, we look fine, but yet inside we're really suffering. And when someone close to us doesn't believe what we have is real, that only compounds the suffering. So my best advice is for you to learn yourself really in detail the science of fibromyalgia, so you understand what's going on in your body, so that you can explain the science of it to doubters and to people that don't understand when they say it's all in your head, it's not real, it's just a wastebasket diagnosis that the doctors tell you when they can't find anything wrong with you. So number one, understand it well yourself. And number two, direct those people to reliable sources that they might actually trust. Like, for example, the Mayo Clinic website has very good, real, strong, research-based information about fibromyalgia. And I've found that those two things can help. However, this is probably one of the most painful aspects of fibromyalgia, is this stigma, this lack of being understood. I deal with it. I mean, I have doctors that know that I have fibromyalgia and still say to me as a colleague, say, why would you devote your career to this illness that doesn't even exist? Which is just astonishing that they would say it to my face, but they do. So I've come up with some very good comebacks, but the best one is really check out the science. It's real. Let me direct you to the science. So that's always my go-to. Next slide. So trigger points. Talked about those painful knots. One of the questions that I answered earlier was, do trigger point injections help? Absolutely. I really like them, both as a patient. I like getting them and I like giving them because they can be so satisfying. So if you can, with your fingers, if you can feel a distinct notch, it can feel like a little pea or a little bump in your muscles. If you can feel that, and when you press on it, it causes pain, get into your doctor and say, right there, you can even mark it with a pen, trigger point injection right there. It can be very satisfying, instant relief of that area. And that area can actually really affect lots of areas close by. This question, it can radiate up and down into close by areas. So trigger point injections, dry needling, or with medicine. I like topical magnesium to apply to this area to help relax the muscles around it. And I recently discovered a very cool instrument called the Thumby. It's THUMBY. It's like a little round pyramid type thing. It's actually a soft plastic, and it's got a suction cup, so you can stick it to the wall and then lean against it. So if you have a trigger point that's in kind of your shoulders or back area, giving that focused pressure to the trigger point, and you control the level of depth, so you can do it only as far as it feels okay. I love the Thumby for trigger point treatment. Next slide. So yes, people frequently report that symptoms worsen during the fall. There have been some studies showing that. What we don't know is why. We don't honestly know why. We don't know if it's because the temperature changes, if it's because it's colder, so people feel if it's more irritating to the nervous system, if it's barometric pressure changes, if it's the fact that there's less sunlight, if it's the fact that there's less vitamin D. We don't know, but I have found that if you live in an area that's in the northern climes and it's cold in fall and winter, and that increases your symptoms, try and trick your body to thinking you're in warmer climates. So ways to do this is, my favorite way is actually using infrared heat lamps. So they cost about $100. They're on Amazon, and they give you this focused infrared heat to sore muscles, but your body thinks that it's the sun. So trying to trick your body into thinking that you're still being exposed to the sun, that is a useful tool, along with infrared saunas are great as well. So now, medical marijuana to treat fibromyalgia. This could be a presentation on its own. There's so much to answer in this, but I wanted to make sure, so many people asked me about it, I wanted to make sure that I was able to at least answer the basics. And what I would say is, medical marijuana has a huge potential as a really good medicine to treat fibromyalgia, but right now the science and regulations are so new that it's really not quite medical yet. So if you're going to, if you're in a state where you can use it medically, or you have a doctor that's willing to recommend it for you, I think the best way to start is with using topical marijuana extracts in balms or salves, applied directly to the area that hurts. So on your painful areas of the muscle, for me, you know, like the jaw, neck, it can actually really help reduce pain right there topically, but not affect your brain and not have any of the high or the psychoactive feeling that people usually don't actually want from the marijuana when they're trying to use it medically. The other option where you can kind of get some standardization of dosing is using using tinctures, which are liquid extracts, and, you know, being able to kind of try one drop and see how that affects you, using it under your tongue. So again, I actually am going to try and work on some sort of expanded webinar, because I get asked this so many times in my clinic. But I would say, for now, use medical marijuana very cautiously to treat fibromyalgia, because we don't know that much about it. We do know that a lot of the ingredients in marijuana can help pain, they can act as muscle relaxants, and they can help sleep. Beyond that, we don't have a good way to recommend dosage or strain or even the best way to use it. And at least in, you know, Oregon, where I practice medicine, there's not any really good regulation, so you don't even know if what you're getting is actually high quality. So I say it's kind of early days yet, but stay tuned. Over the next 5 years, there's going to be a huge explosion of kind of research into medical marijuana, and hopefully a lot better ways to utilize it as a true medicine, not just sort of this haphazard trial and error that folks are kind of forced into right now. Next one. So yeah, this is a pretty controversial question, based on today's current environment around opioids, which are pain medicines derived from morphine. So in general, there's a huge backlash now against opiates or opiate-based pain medicines in medicine. So doctors are really backpedaling and really feeling very uncomfortable prescribing this type of pain management. And I think in an ideal world, opioids are not perfect medicines. They do have some problems. They have some issues with, they can lead to dependence, where you might experience withdrawal if you stop them. They can lead to addiction, where people are misusing opioids, although that happens a lot less frequently than we actually would think, based on what we read on the news or hear. It can happen, but it's a lot less common. But the really big problem with opioids is that if you take them every day for a long time, many years, over time, they can actually increase your pain levels, not decrease your pain levels. So they're not perfect medicines, but we don't have great alternative options yet. I mean, we don't have a lot of alternative things to recommend. So until we have better, more consistent medications to recommend, or non-medication treatments, I still think that opioids have a role in managing fibromyalgia symptoms. The key is to use them correctly, and the best way to use them is to use them just as needed for severe pain flares only, keeping it to about 10 days or less a month. If you do that, and that's how I try to have all of my patients in my clinic utilize them, if you do that, they can maintain their efficacy without tolerance, without dependence, and without the over time worsening of pain. So there is a role, but I think it has to be done carefully, and trying to thread that needle, find that line, is another piece that I think doctors and patients need to be educated about. But in the meantime, I do think it's worth having a conversation with your doctor saying, okay, I understand that you don't want me to be on daily opiates. How can we work together to find something where I can still have management of my flares and help me develop other tools to utilize that are not opioids, so that then you're kind of in a partnership with your doctor as opposed to an adversarial role. And then I think next question. So I have a hope and a dream that I will one day be able to really reliably recommend local doctors that you might be able to work with who are familiar with my work. Until then, I would say best resource is the Institute of Functional Medicine. Their website is functionalmedicine.org. They are the type of provider that are trained in the same type of integrative holistic treatment that I am, and they're more likely to be familiar with my work, and they're more likely to be willing to work with you on the treatment plan in the FibroManual. So I would say functional medicine doctors or naturopaths, holistic doctors locally, and bring in the FibroManual and just ask, hey, would you be willing to work with me on this? Sometimes your doctor might surprise you, particularly if you're doing it in a way where you're saying, hey, I understand that you're really busy and you've got a lot and you might not know that much about fibromyalgia, but here's a doctor that can help both of us to understand it better. And if you go at it that way, often, doctors can surprise you. So give them a chance, your local doctor. And then final question, I think, is, are there any new medications out or about to roll out? Well, the only one that's really kind of getting close to rolling out is a updated version of pregabalin or Lyrica. It's a longer acting form. I'm not hugely excited about it because we already have a similar medicine in Lyrica. Other than that, unfortunately, there is not right now a lot of medications being studied for fibromyalgia. And what that means, unfortunately, is there's not that much pharmaceutical research money going into studying fibromyalgia. But there are a lot of small companies doing research on smaller either medications. There's a short-acting cyclobenzaprine, Flexeril, that's coming out from a small company. And then there's a lot of places looking at things like specialized marijuana tinctures for fibromyalgia. And then there's a lot of the lab and genetic studies. There is money being poured into fibromyalgia. It's just not in the medication world. But you know what? A lot of us really want non-pharmaceutical options anyways. So I think that this could be an exciting time where we start to see more studies on non-pharmaceutical things, or at least non-prescription options. So I want to leave you with hope that there are new treatments coming out. They may not be what you think, and they might not be from the big pharmaceutical companies, but they are coming. Pay attention to what's happening in your state with the medical marijuana. There's a lot of companies looking at, can they find a particular strain or extract of marijuana plants that are particularly useful for fibromyalgia. So maybe there will be a fibromyalgia cannabis strain that we will find that could really be a game changer, and it won't be from a pharmaceutical company. So that's kind of the future to look for. I really want to thank everyone for joining today and hope that I was able to answer some of your questions. And I want to encourage you to stay tuned to the details aren't quite worked out, but I'm going to answer as many of those questions that you sent in because they're phenomenal. I'm going to answer them in some sort of article or column through the NFM CPA, who, by the way, does amazing work. And thank you, Jan, for having me on this.
You're welcome. On behalf of the NFM CPA, I'd like to sincerely thank you, Dr. Lipton, for spending this evening with us to discuss the FibroManual and answer questions from our viewers. You provided valuable insight for all of us, and we sincerely appreciate your dedication, leadership, and advocacy for the fibromyalgia community. To our viewers, thank you for your constructive contributions and thoughtful questions throughout this webinar. We have been positively overwhelmed by the strong response to this Ask the Expert webinar and are pleased to announce there will be future events to answer your questions. Tonight's webinar is available on the NFM-CPA's YouTube channel. We invite and encourage you to subscribe to our channel for access to our videos and live streams and to receive notifications of new videos. Thank you for joining the NFM-CPA in our Ask the Expert webinar tonight. We look forward to seeing you next time. Good night.